Welcome back. The social isolation of the pandemic can be a lot for humans to handle, but our next guest says that too can lead to serious heart issues. With us now is Dr. Sinatra with Healthy Directions, the cardiologist and a psychotherapist, and is here to talk more about heart health. Good morning, doctor. How are you this morning?
Good morning, Elizabeth. It's good to be with you.
Thank you so much for getting up early for us. We appreciate that. Can this isolation that we've been dealing with for so many months, can it lead to heart issues or what you call heartbreak?
Oh, definitely. I wrote the book Heartbreak and Heart Disease years ago, and whenever you're lonely, depressed, and feeling low, it's an awful sensation for the heart, because the heart responds to biochemicals that are released from the brain, and there's hormonal interactions. So whenever you're lonely or depressed or isolated, oh yeah, the heart gets affected big time.
What are you seeing in patients this year that's different than maybe years past?
Well, this year, the loneliness is a big factor. And when people are lonely, it just creates intense sadness. And the problem here is if you don't release the sadness, if you don't have the sadness or cry it out, so to speak, the body stuffs the sadness. And again, these neurohormonal interactions tend to soar. Cortisol is released, adrenaline is released, people become more and more depressed, more and more sad. And when this happens without crying, but if you do cry and you release the heartbreak, then it won't lead to heart issues or heart disease. And I'm convinced as a psychotherapist and as well as a cardiologist that these feelings really have an incredible impact on the heart.
Doctor, I'll let you in on a little secret. I'm 9 months pregnant, so the crying portion has not been difficult for me these past few months. But
well,
what else besides crying?
That's very, very good. I like that.
A commercial, you know, we're at that point. But tell me what else we can do besides kind of crying it out. What other tips do you have for people that just feel so isolated?
Well, you can eat foods, for example, like salmon or sardines or nuts or seeds. Remember, these foods have DHA, and DHA, what we call it docosahexaenoic acid. It's an essential fatty acid. It gets inside the brain, and it helps with depression and low mood, and it makes sense. And remember, salmon and sardines contain coenzyme Q10, and that's an incredible nutraceutical that tends to support the brain function as well. So I'm all in on eating these types of foods. Even eggs, for example, contain a little bit of DHA if they're range-free or cage-free. So I'm all in on some of these foods. These are great foods.
That's great. You also recommend meditation and things like journaling.
Yes. Yoga, for example, is a great way to meditate. I remember when I was teaching at Cervananda down at the Yoga Institute, I would do the cobra pose. You know, we would put our hands on the floor, our elbows close to, our side, arch the back. And whenever you arch the back and hold that and breathe, it's important to breathe. If you do that for 30 seconds to a minute, not only does it help to relieve stress and tension, it relieves back pain, which is huge. So many people have back pain, and doing that simple cobra every day for 1 to 2 minutes is just incredible for relieving that stress.
Okay, we're out of time, sadly, but you also suggest herbs, and my favorite, of course, is dark chocolate. Where can people get more information on these tips?
Oh, on healthydirections.com is great. Vervana.com, that's my healthy food website. But dark chocolate contains phenylethylamine, which is the feel-good hormone. That's the hormone that helps people really feel much better.
Again,
a little each day is good. A little each day is very good for you.
Again, 9 months pregnant, I have no problem eating chocolate. Thank you, doctor. Thanks so much. Happy holidays.
And the darker the better, Elizabeth. The darker the better.
Got it.